One of my favorite football players of all time, prime time, Deion Sanders. Amazing news that he had bladder cancer. Of course, with Deion, he's going to be public about a major health crisis like this, and it's such a private issue. I'm really just amazed at his openness, and it's going to really open up awareness of bladder cancer. Right now, the major presentation is blood in the urine. And most people, most men, they ignore this for 6 months before they come in telling their doctor that they had blood in the urine, but it wasn't painful. That's really the number one sign for bladder cancer. There's risks such as being over age 55, which Deion was, being male, which Deion is, and also being a smoker, which he is not. In fact, he's very healthy, doesn't smoke, doesn't drink. Again, a healthy guy like him to get bladder cancer, you really hate to see that. But what he's done and the awareness he's going to bring to this disease is amazing. I think the robotic removal also was a big thing. They removed his entire bladder. They created a new bladder using his bowels. He's going to have issues from that, but that's a decision that he and his care team made. Usually with non-muscle invasive, high-risk bladder cancer, lots of people will usually pick a treatment like BCG, a removal, meaning we're not removing the entirety of the bladder, we're trying to spare the bladder. There's that BCG has been around for a long time and is very effective, 60 to 70% versus 80 to 90 with the surgery. Best wishes to Deion. For us, for our patients, remember, blood in the urine is usually the main presentation. His was picked up on a heart scan. Usually on a heart scan, you don't image the pelvis. They must have just extended the field, and that's how they found his mass. Bladder cancer, if you catch it early, can be curable. There's multiple ways of treating it. We have studies going on right now looking at alternatives to these treatments such as BCG, and there's so many more treatments that are coming out monthly that it's really an active area for in urology is bladder cancer right now. Best wishes to Deion. It sounds like he's licked this disease according to his doctor, and he's back on his feet. He's going to coach. Again, for the rest of us, blood in the urine, please go see the doctor. If you're other risk factors, male, being age over 55, being a smoker, those are the things to really be looking out for.